This is what HICS, the Hospital Incident Command Structure, looks like. It is an incident commander helped by public information, safety, and liaison officers, and sometimes another specialty position that's under there. And everybody else is operational under these other categories, which is logistics, planning, finance, and operations. That means that everybody here would be working under that kind of structure if, in fact, we needed it to activate this. The importance of this ChemPack project, and in fact any disaster issue, is that you have to follow notification and communication procedures very carefully so that we're engaging the people that we need to engage at the points and times that we need to do that. We are also communicating with what is called the Medical Operations Center, and that is the county Medical Operations Center that is at Emergency Medical Services. As well, we also have relationships with other volunteer agencies. Amongst them are the amateur radio operators who will respond to hospitals and help us with communications in these events. And we activate our internal procedure. Our internal procedure involves activation of HICS, a process sequence. We have authority to open and distribute this if we need to. We don't need to ask permission to do it. We can just go ahead and do it, and it might be an ED physician or our trauma physicians who recognize this is what we need to do. We can take that action and then notify the county that that's what we have to do. We can provide immediate antidotes and related pharmaceuticals via that. It's done through pharmacy, and our Department of Security is also very involved because they have to accompany the medications out to the site. This is just simply a picture to show you that in fact we have a quick information sheet within the pharmacy about how this will be handled. We also have options for transportation and movement. It is possible that we would be called not to use our cash but to bring it or to take it someplace else. That is possible as well. In those cases there are also custody transfer because it involves pharmaceuticals that are needed. Post-event, there are issues with notification, the documentation of how we used it. We want to really return the ChemPack to its present state so that we have it if we need it again, and a replacement requests are involved. Dr. Jay Doucette, who's going to speak to you about some of our antidote reviews and some of the clinical aspects that are a part of this project.